Well, we're going to get started with our webinar today. We want to be mindful of the time. So I'd like you to know my name is Kristen Kidd, and I'm with the Southeast Prevention Technology Transfer Center at Wake Forest. And I'm going to do some of this housekeeping first. Our disclaimer we need to say is that the webinar is being recorded and it will be archived and placed on our website, so you'll have access to it later if you want to share it with colleagues. But we want you to note that the views expressed in this webinar do not necessarily represent the views, policies, and positions of our funder, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. So this is the Prevention Technology Transfer Center, the entire network. It consists of 10 regional centers. It began in 2018. There are 10 regional centers around the nation, and then there are 2 population-specific, the the American Indian and Alaska Native PTTC, and then there's also the National Hispanic and Latino PTTC. But each PTC in the region, we're here to provide services to help with the implementation of your prevention work, to really build the capacity of the prevention field, and to provide free technical assistance and training. And I've highlighted here the Southeast region. This is the region we at Wake Forest serve, Region 4, and it consists of 8 states. So we are going to be doing an evaluation today, and this is the little QR code that you could take your cell phone if you'd like and put the camera over it. That will send you to the evaluation, which you can complete at the end. And after you complete the evaluation, then you will be directed, you'll see this, the survey is complete, the evaluation survey. Select this link to continue. This is going to send you to a certificate that you can print off. It's a PDF. You can customize it with your name so that you get credit for attending today's webinar. But the certificate will show up at the bottom of your screen. So I hear from a lot of people saying, I didn't get my certificate. You got it. It's just down below, and you have to click on it, open it up, and customize it. And then you can print it off or save it to your files. So this is the agenda for today. Our co-director, Dr. Kim Wagner, is going to be introducing our presenter. And then Cassandra Tourre is going to share her outstanding presentation. We're going to have an opportunity for you to participate in Q&A. You can type your answers in the Q&A box or the chat box, and we will pull those back in at the end and address as many as we possibly can. And then I'm going to share a little bit of announcements, and we'll remind you again about the evaluation. So with that, I'm going to ask Dr. Wagner to come off of mute, and she is going to set the stage for today and introduce our speaker.
Thank you, Kristen. Can you hear me okay? Okay, perfect. All right, so hi, everyone. I'm Kim Wagner. I'm the co-director at the Southeast PTTC, as Kristen said, along with Dr. Mark Wolfson. So we are delighted today to have Cassie Tourre join us to share the first of a 2-part webinar series focused on alcohol policy. So today's webinar is part of our center's focus on developing tools focused on policy development and advocacy. And we'll have several tools coming out in the next few weeks to months, focused on really self-paced online learning. But today we're really excited to kind of kick this off with Cassie, who is the Director of Public Policy at the National Alcohol Beverage Control Association, also known as NABCA. And this is a trade association representing alcohol regulators. She has 15 years of public health experience related to the regulation, enforcement, and marketing of alcohol. Prior to joining NABCA, Cassie was faculty associate at the Johns Hopkins Bloomberg School of Public Health, where she worked on both statewide and national projects, implementing and assessing strategies to address excessive alcohol consumption. So I'd like to turn it over to Cassie for her presentation, Shaping the Alcohol Policy Environment, Past, Present, and Future, Part 1.
All right. Thank you, Kim.
Cassie, I've given you the power to advance the slides as you will.
Thank you, Kristen. Well, it is a pleasure to be here with you, and I look forward to the 2-part series we're going to do in the next couple of weeks. So Shaping the Alcohol Policy Environment, Past, Present, and Future. So here's where we're going to take the presentation for this part one. We're going to go over the history of alcohol regulation and consumption trends, and we're going to talk about the science and effective policies, and then we're going to follow with Q&A. And we'll be monitoring the chat for those Q&A, so please, please, please ask questions. We want this to be a robust conversation, and we'll have a few polls along the way to get myself oriented to who's in the audience. So Kim did a great job of summarizing who the National Alcohol Beverage Control Association is, but just a quick, I'll add a few more things. So we were established in 1938, shortly after the federal repeal of Prohibition, and our primary governing board members are control systems, states that are in the business of selling the product. And we'll talk more about that in a minute, but either at wholesale or retail, and in the Southeast region, you have 3 control jurisdictions. So that's our primary governing board members, but we have many, many members from lots of different sectors, from public health, public safety, beverage alcohol industry, from all the different tiers, as well as other regulatory agencies from many other states beyond control jurisdictions. It's always important to recognize that as a trade association, many are advocates for their members. We are not. That is not a role that we play for our membership. And we're also not a beverage alcohol industry organization. I can't tell you how many times I'm presenting or at public health organizations, national conferences, and they hear the name and think automatically we're a beverage alcohol industry organization, which is not the case. They miss the word control, the National Alcohol Beverage Control Association. But what we are is an entity that works very hard to bring the best, most robust data and information around beverage alcohol from all different perspectives, so that you can ensure we will have. What you do with that information, by all means, take it and do as you wish. But what we're about is trying to make sure we're seen as the sort of the point, the place to go for this kind of information. So our membership, I already went over that a bit, so I will jump this pretty quickly, but we do have a little contingency from the international community and also various government officials. So a little background about me, just so you can get oriented to my experience, and Kim also did a nice job giving an overview of that as well. But I'm presently the Director of Public Policy for the organization, and I started my work in public policy and in prevention, working specifically on alcohol prevention, back in Nebraska, which is my home state, where I'm born and raised from, and have a lot of people who I still love and care for who are still in that state. And I worked for a small nonprofit organization where our charge was to prevent underage drinking. And we did that through policy changes from what the evidence says we should be doing, to enforcement collaborations with compliance checks and other source investigations, and working with high school students to help them find their voice on these issues, because they have a lot to say and there's a lot of power there in the youth voice if you can kind of galvanize it. And we did awareness efforts as well, but the focus was policy enforcement and engaging young people in that conversation in addition to adults. And after serving as the director of, or the associate director there for a number of years, I had an opportunity to go and work with Dr. David Jernigan at the Center on Alcohol Marketing Youth at Hopkins, and it was a phenomenal experience. And there I got to do a lot of work with colleges. And, you know, back in Nebraska, I didn't have that kind of experience, but moving into this role at Hopkins, we had an initiative called the Maryland Collaborative to Reduce College Drinking and Related Problems. And there I worked hand in hand with colleges and their community and neighborhood associations to work on social host ordinances. And we were fortunate to pass 2 local social host ordinances. So I have a wealth of knowledge on social host, and I know the team here has a lot of experience on that particular policy. And then finally, I do a lot in my spare time as a volunteer. I used to live in Baltimore, and I work with the neighborhood associate or coalition called the Baltimore Good Neighbors Coalition. I'm very active in this coalition because I believe that, you know, it's important to take your expertise, and sometimes you may not be able to advocate individually in your professional capacity, but you absolutely have that right as a citizen, and I exercise it, guaranteed. So with that, the overarching goal of our policy work at NABCA is to connect public health prevention to regulation and help regulators better understand public health and public policy and the public health scientific literature that informs and should be shaping policy. So now you know a little more about me. I want to know more about you. So Kristen's going to open the poll, and I'd like to know which sector best represents your role, just so I can get a sampling of where you are coming at in your perspective. And hopefully these 4 categories are not too limiting, although I do see there's an other category. Thank you, Kristen, for seeing that oversight on my end. So I appreciate that help. And we're just going to keep this open for about 15 more seconds or so. So please, this is sort of one of the only ways you can have this level of this feel engaging. So give me your feedback. I need that as a presenter. I miss in person. I know we all do, but these polls can be very, very helpful. So let's see those results. There we go. All right. So the vast majority of you are coalition leaders, substance misuse prevention practitioners. So that's what I was expecting. So that's helpful, and I think this presentation will definitely be good for that particular audience. A handful of you are from the treatment provider end, some are from other, although a few, and a couple of you didn't answer, so please engage in these polls. It'll be very helpful. But most of you are coalition leaders or misuse prevention practitioners, so thank you for giving me some orientation there. So starting off with the history, it's really important to know where we came from and on alcohol regulation. And too often we hear one narrative, which is prohibition failed. And that's a really short-sighted way to surmise where we've come. So I'm going to take you through a more detailed historical perspective about where we came from. So early on, the ancestry of this country, the European immigrants, kind of first wave, if you will, brought pretty heavy drinking culture in their products at the time to this country. And at the time, alcohol was considered a very healthy thing, and it was extremely high consumption rates, nearly twice the consumption rates that we have today, according to some historians. In fact, it was so integral into our work in our lives. At the time, people had breaks. Workers had breaks at 11 and 4 to imbibe. And that's just, kind of hard to imagine that was the way the culture was, but it was very prominent. And this was mostly hard liquor. And alcohol was often just an absolutely necessary incentive to get elected. Boy, is this an appropriate topic right now after we're just coming off the heels of an election yesterday. So even George Washington supposedly lost an election because he failed to provide alcohol to prospective voters. So it just gives a sampling of just how integral it was in the early years. Moving on, it was also a very important commodity for the economy. And we hear that same kind of conversation around craft products today with local breweries, local distilleries, and wineries. So we absolutely hear this conversation yet today, still many, many years later. But at the time, back in the 1750s, early 1800s, there was a surplus of corn, and they needed to figure out how to transport it because we had really poor transportation, and we were able. There were no good roads, not really any railroads yet, no water transportation. It was very limiting, and so the solution was to change the corn into whiskey. And that was much easier to transport, and also they wanted to make sure they could get that to the east, which is where the heavy drinking population was at the time, where the population was generally at the time. So there was sort of in the new wave of immigrants came to the country from Germanic countries, and along with them they brought their beer and brewing skills, and their beer became the drink of choice at that time and was primarily sold in saloons. And what was interesting about saloons is that they created this tied house, which is a really important concept to keep in mind as we work through this presentation. Which meant that they were owned by a brewer who required exclusive sales of their beer brand. So we liken this to if you ever go to a restaurant and they only carry Coke products, or if you go and they only carry Pepsi products. That is how it was with alcohol at one point in time through the tied house. It only had certain products sold in those saloons. And what this fostered was intense competition in the saloons. They were hyper competitive. They used inducements such as gambling and prostitution and other methods to maximize the sales. And that created just a lot of social unrest, social ills that really started shaking things up in terms of the need for regulation. But there was very little regulation at this time, and this really led to some serious challenges. So the state struggled over time with how to handle alcohol problems. And so, we had the 18th Amendment was ratified in 1919, and then it was prohibition ended after 13 years in 1933. So what we have in this sort of natural experiment, if you will, is the 21st Amendment that gave the states the explicit right. So the story is, national model of policy on alcohol regulation, federal prohibition was a failure, yes, from an enforcement standpoint. It was an utter failure from that perspective. However, people, in terms of public health success, did reduce their consumption. That is part of the story that's never told. That is an absolute fact. It did happen. However, the challenge with federal prohibition was we treated this country like it was of one mindset on this topic, and that could not be further from the truth. And the 21st Amendment, once federal prohibition was lifted, gave states the explicit opportunity to shape rules and regulations and laws that reflect the will of their community. And usually the idea here around policy is if the public supports the policy, they'll be more likely to adhere to the policies. So that's the idea. And then 21st Amendment created that kind of structure. And that is why we see a lot of variation across the country, state by state, locality by locality in some cases, of variations in alcohol laws. So, but states had no experience with alcohol regulation, so they've been given this authority, and now what? What do? There was not a roadmap. And so, interestingly enough, the John D. Rockefeller commissioned two researchers, Fosdick and Scott, to create this blueprint called Toward Liquor Control. They interviewed 400 different researchers and went to and visited other countries to understand how they did the regulatory systems. And they came away with some very clear guidance. And I will tell you this guidance is very applicable still today. So when you look at what the guidance was, number one, reduce aggressive sales tactics. Reduce those tactics such as incentives to consume in high volume. Prevent vertical integration. That's the tied house we talked about before. So don't let producers own retailers. And that was a really important concept coming out of federal prohibition that the country was attempting to avoid. So prevent that vertical integration and so that there wasn't a dominant player in the marketplace. Number three, restrict outlet density, hours and days of sale as a way to reduce and prevent excessive alcohol consumption and place more limits on higher alcohol by volume products. So we do see traditionally spirits in this country and elsewhere, honestly, are treated differently. They are taxed more heavily. They are often sold in fewer locations, and they used to have more restrictions around advertising, mostly by voluntary agreements, not by regulation necessarily. But nonetheless, those have mostly gone by the wayside in present day. But they also had the control model. So states could go in two different routes, and the book, Toward Liquor Control, recommended the control model. The control model, the idea is that the business is in the sale of the product, whether at wholesale or at retail. And this was a mechanism to remove the incentive for massive amount of profit at the expense of the public. And there are a number of states that opted for this model, but Fosdick and Scott in Toward Liquor Control recognize that, look, most states are not going to adopt that model. Most states are going to do the private, let the private sector drive the bus, and those are called licensed systems in the country. But just know that coming out of that book was a recommendation for the control model. And as you'll learn, control systems as they exist across the country, they are primarily charged with regulating the sale of spirits. Again, as a mechanism with that same kind of thread pulling throughout of controlling higher ABV products more restrictively than the other beverage categories. So here are the control jurisdictions across the country. There are 18 jurisdictions, but you'll see here the dark gray are the 17 states that are control jurisdictions where the state is in the business of selling the product, and there are a couple of localities that do it as well, including Montgomery County, Maryland. And Washington State privatized fully. In recent times, there has not been a state for many, many years that had done that, but Washington State in 2011, by referendum, people voted to fully privatize the system, so they are no longer a control jurisdiction, interestingly enough, which, certainly gave researchers right for study in this natural experiment, and we have a lot of now good peer-reviewed journal articles that have told us what happened with that particular natural experiment. And I would just say we have a whole PowerPoint on that if anyone's interested. So the other important factor here is that control systems also have sort of a natural mechanism of support for the infrastructure. And this is something that's often not talked about, and I think it's really important to extrapolate. And I'm using North Carolina just as an example, but the other jurisdictions in this southeast region, Mississippi and Alabama, are also control jurisdictions, and I could have also told their story, but in the interest of time, I will spare you and only focus on North Carolina. But when I talk about the infrastructure in control jurisdictions, because the state is selling the product, money goes back into the general fund in all of those states. But there are also revenues that go to county and city government in some cases, as that is the case in North Carolina. They will go to support local education programs, as is the case in North Carolina, and they can often go and support alcohol law enforcement. So you have this sort of feeding of funds going back to the state to support the infrastructure to monitor the environment in which these licensees are operating. So that's an important takeaway, and not every state breaks it down this way, just to be clear, but one commonality is they all do put the money toward general fund, but there are other carve-outs, and you can see how that takes place in this particular example with North Carolina. This is an important value of the system that is discussed, not talked about enough, in my opinion, and it's an opportunity for prevention and public health to understand the value of a system like this if it exists in your state. But regardless of whether you're a licensed state or a controlled state, all jurisdictions, any one of these states that you are sitting in, they license people to sell the product. They enforce the laws to reduce underage and excessive drinking. They regulate days, hours of sale, location, premise, and the density of outlets. And they require products to flow through what is called a three-tier system. I'm going to spend a minute on the three-tier system because it's a very important concept that is operating in the background of our alcohol regulatory systems in this country. It is very unique to the United States, the three-tier system, which is the producer, wholesaler, and retailer. I like to think of this concept in an hourglass. So you have your producers at the top, we funnel down to the wholesaler, and then it fans back out to the retail community. And what happens with the wholesale tier is that there's the ability to have efficient tax collection. We have near 100% tax collection in this country. We are hearing a lot of debate on cannabis, and they'll say we need to tax it and we can use that money for prevention services, et cetera. But if you don't have an efficient system to collect those taxes, then it's a moot point. And this three-tier system in the alcohol beverage landscape provides a very efficient mechanism to collect those taxes that folks were promised many, many years ago in allowing alcohol to be sold in this country. So we want to make sure those taxes are collected, both at the federal level and at the state level, and sometimes even at the local level in jurisdictions. But the other thing the wholesale tier does is tracks down tainted alcohol products. So if in fact there happens to be, shards of glass that get into a beer bottle, for example, the wholesale tier is the entity that identifies that, tracks it, and can pull it off the shelf very quickly. That is a consumer protection that's critical. And again, most people have never heard of this ever before. And so if this is a new concept for you, that's okay. You're not alone. But it is instrumental to our system and to the protection of the public. This is a quick overview of the three-tier system that kind of gives everything I just shared with you in quick, succinct way. But in the interest of time, we'll move forward. So generally, just keep this in mind as we move forward. The pillars of alcohol regulation are first and foremost to protect the public health and safety. Even if you're a control model, oftentimes states can focus on the revenue generation, and the state will focus on that for their budget. But the bottom line is that the mechanism of selling the product was to prevent excessive alcohol consumption, ultimately prevent public health and safety harms. So that's the first and foremost priority of what alcohol regulation is intended to do. Secondly, to ensure there's efficient tax collection and revenue collection occurs, to eliminate unfair or illegal marketing practices that happened, prior to Prohibition, and even during Prohibition, we had a lot going on in terms of the illegal marketplace. But in this case, that was a primary focus of alcohol regulation coming out of Prohibition nearly 100 years ago. And then finally, balancing all these different interests. And as preventionists in the field, it's really important that you carry that voice into these conversations with alcohol regulators to help balance that conversation, because certainly industry sector is having that conversation daily with regulators, and it's important for prevention to make sure their message is getting heard about the potential harms that alcohol may cause. So alcohol regulatory changes are happening, and certainly COVID has put a fine point on that. It has rapidly changed the environment, probably historically, I would say, in terms of its rapid changes. But it's important to see here that all branches of government have some role. And, using COVID as an example, we have had executive orders that have closed down or limited hours of certain operators selling alcohol through executive orders. In some cases, states have felt like that has gone well, as is in Iowa, where they decided to make cocktails to go permanent, and that was done through legislative change. But then it went back to the executive branch with the Alcohol Regulatory Authority to establish rules and regulations around that. Putting a spotlight on North Carolina, again, they adopted rules and regulations once the legislature allowed home delivery of certain beverage categories through third party. When they did that, the executive branch with the North Carolina ABC had to establish rules and regulations around how that was going to be executed. And of course, the judicial branch, I would argue, is perhaps making the biggest sweeping changes to alcohol regulation to date, which we'll talk about in part 2. So a little teaser. So when you think about the 4 Ps of marketing, which is a marketing concept, price, place, promotion, product, alcohol regulation has the opportunity to impact all of these areas. And whether you're in a controlled state or licensed state, they do impact these categories. If you're in a controlled jurisdiction, they have a little more opportunity to directly impact these, versus in a licensed state, they often have to go through the legislative branch to make some of these changes. So here's at the high level, you need to know where your alcohol regulatory system is housed. And the bulk of the state's regulatory systems are housed within finance, commerce, and revenue departments, interestingly enough. Why is that? It's been modeled largely after what the federal government did. Yes, the federal government still regulates alcohol to some degree, although, again, largely it's at the state level, but there are components that are still at the federal level. And they're housed in the Tax and Trade Bureau with a primary responsibility. Interesting factoid. So a lot of states emulated that and modeled it. And again, they wanted to make sure there could be proper tax collection. So it does make sense at some level that was what where states decided to house it. Some are standalone, meaning that they are just directly under the governor. They're not within another department, and that's the next kind of largest contingency. A few are in public safety and consumer protection divisions, and then a handful are in licensing, regulation, or attorneys general offices. This is important because it helps you better understand what frame your regulatory entity might be coming at, depending on where they're housed within the state government. So, taking the 8 states here in the Southeast region and doing a side-by-side state comparison, it's critical that you understand where these control levers lie within your state, because they are different. As we said, every state adopted a different modality and a different method to do it, to bring the product to market and protect the public. So the states you see in blue are control jurisdictions. The states in orange are licensed jurisdictions. Then you can take it down. 2 of the states are directly under the office of the governor. Alabama and Tennessee, whereas many others, Mississippi and Georgia, are housed within the Department of Revenue. Kentucky and North Carolina are in sort of a public safety, public protection commission arm. Drilling down a little bit further then, some entities of the Alcohol Beverage Control Board have both licensing and enforcement responsibilities, and others have this split. So South Carolina is a good example of that. South Carolina, they have the Department of Revenue, and that's where licensing takes place. And in the law enforcement division, under the Office of Alcohol, Narcotics, and Vice Services, is where enforcement of the alcohol laws happens. So when you're thinking about your strategies for your various efforts, when you think about the landscape and the challenges that your state is facing, it's really important to understand the landscape. And it isn't always easy to navigate that, which is why I took the time to pull this out for you so that you can see very clearly where responsibilities lie within your state. I want to spend just a minute on enforcement because it can be complicated when you think about alcohol enforcement, but there are so many things in that umbrella. One is background checks and inspections. So background checks for licensure and then inspections of those licensed establishments. That's typically an administrative function, but not always. Sometimes law enforcement police will assist in that. Trade practice violations. So when I talked about ownership in different tiers of the 3 tiers, that could be trade practice violations. And that would be law enforcement at the local and state level have to identify those issues, and then they take it up to the TTB at the federal level to identify those trade practice violations. TTB just recently got a lot of funding to do more trade practice monitoring, which had largely been very underfunded for a long time at the federal level. Zoning, permitting, and planning authorities at the local level have a lot of autonomy, typically in a state, to, put distance restrictions in and to establish what type of license can go in a different part of the community. I formerly lived in Baltimore City, and they had liquor stores in residential areas that they were looking to pluck and move because they said that was in violation of the zoning code. And they also, which I think most of us are probably most familiar with these last two, sort of buckets of what falls under the enforcement regulatory landscape, is criminal and nuisance in and around licensed premises. That typically it falls within the jurisdiction of police and perhaps inspectors within the regulatory authority. And finally, compliance checks, which is something I'm guessing many of you engage with law enforcement on, or your alcohol regulatory authority on, which are, evidence-based practice to do underage compliance checks, source investigations, over-service monitoring of operations. So in Mississippi, I would love to tell everybody about this really cool project we're doing about over-service, and maybe if there's time, I can mention it. So efficient enforcement and compliance it really has to have resources to do dedicated enforcement, so it's not always reactive, it can be proactive. The coordination between the federal, state, and local, hopefully in my examples on the prior slide, you saw very clearly that there's a lot of synergy that's going on between these 3 levels of government that need to work together to do proper compliance monitoring. And finally, collecting the data and evaluating that data to inform regulatory practices is critical. In any one of these areas, I can see a prevention voice being impactful to shape how it looks in your state. And in part 2, we'll talk more about those opportunities. So consumer trends, what's happening with alcohol consumption? So let's make sure we're all starting from the same place on what is excessive drinking. So if you would indulge me here and take this quick poll, Kristen, if you would open it up. What is the definition of excessive drinking? Binge drinking, 4 to 5 or more drinks on one occasion. B, heavy drinking, 8 to 5 or more drinks per week. Any alcohol used by pregnant women and anyone under the age of 21. D, all of the above. So is it A, B, C, or D? We have about 20 seconds, 10 seconds left to participate. So what do you think the definition of excessive drinking is? All right, the poll is closed. All righty. The majority of you got the correct answer. It's D. It is all of the above. According to CDC, this is how they define excessive drinking. It's binge drinking, heavy drinking, any alcohol used by pregnant women, and anyone under the age of 21. So by saying, we're working to prevent excessive drinking, you are identifying a lot of different potential outcomes here. It's a nice captured a term to be able to use to define what you're trying to prevent. And here's just a lovely infographic that the CDC has to paint that picture of what excessive drinking is. I like to take an opportunity to just sort of demystify some of the common myths I hear, and perhaps you hear too, out when you're working in alcohol prevention, which is, if we can just treat our way out of this, or we just got to work with people who are alcohol dependent or people who have alcohol use disorders. And that is not wrong or bad. It's important, but it's also really important to know that 9 out of 10 people who drink problematically, who drink excessively, according to the CDC definition, they do not meet the diagnostic criteria for being alcohol dependent. So if strategies are only focused on those who are alcohol dependent or have an alcohol use disorder, we're missing a very large part of the population that's causing problems and harms in our community. And I would give you all a challenge to think more broadly about strategies if that is the approach that you've taken, because again, you're missing an opportunity to hit the larger population. Another common myth is, or rather just focus, is we just need to save all the kids. We need to stop them from drinking. That's what we're about. And that's so important. And we have made tremendous progress on that across the country. Underage drinking rates are going down. Although I believe, if I read correctly, in the 8th grade level, it's starting to uptick again. But on the whole, generally speaking, we have made tremendous progress there. And that's because of the intentionality behind funding that's come into states to do really effective strategies like underage compliance checks. But the reality is, when we look at now this slide is very out of date, I recognize the CDC updated their alcohol attributable harms to 95,000 alcohol average annual attributable deaths according from alcohol. It's 95,000, not 88,000 anymore. That just was updated a month ago. But ultimately, still the message is, the point is taken here, which is 95% of those 95,000 deaths are people over the legal drinking age. 5% are those under the legal drinking age. So again, if your strategies are only about saving one more kid or getting to kids and educating them, or focus just solely on underage compliance checks as an example, we're missing a large part of the population that's drinking problematically, and these are in experiencing harms. It's in the adult population significantly and worth looking at. So half the adults do not drink. Also a little misconception often. Half of the adult population does not drink, or according to current drinking standards, that's past 30-day use. And so that's just an important fact to know. For one reason or another, they would not be considered current drinkers. But those who do decide to drink, adults, 2 in 3 are drinking outside of what are moderate levels. And moderate drinking, as it stands today, although the dietary guidelines are under review right now, and there's been a new suggestion by the Scientific Advisory Board to change this, but as it stands today, this is what's considered moderate drinking. Up to 2 drinks a day, not more than 14 for men, and up to 1 drink a day, not more than 7 drinks a week. So the dietary recommendations for 2020 has changed that to 1 drink for men to match that of women based on the evidence. We don't know if that'll be adopted by the dietary guidelines or by the FDA, but at this point it's been a recommendation. But as it stands, this is what is defining moderate consumption. And these drinks we're talking about here, 2 drinks, 1 drink, we're talking standard drinks, standard drink measurements. So, you drink a can of Four Loko, that is not a standard drink. There are many standard drinks in that drink. And that's where it gets a little confusing about what is moderate consumption, and it can be easy to fall outside of outside of the scope. So when we look at binge drinking, there's prevalence and then there's intensity. And on the left here, you're seeing prevalence. And this is according to Candy et al. In 2015. They sort of drilled down on this binge drinking measurement to say, okay, a state like Idaho, for example, has very low prevalence of binge drinking among its adults. But when you look at their intensity of drinking, much different picture. They are very deeply red in the intensity of drinking, total binge drinks per binge drinker. So something's happening there. And so folks that work in Idaho, they may want to consider, well, actually in this southeast region, we see a number of the states that are falling in a similar category, very low prevalence. But those who do drink, they're drinking with a lot of intensity. When you're drinking with a lot of intensity, we know harms and the likelihood of harms are increasing. This is powerful information to tell your prevention story in your state, in your local community. And I challenge you to use these types of data to tell that story because and also shape your prevention strategies. The other trends we're seeing just generally is that consumption is on the rise, and it's on the rise in women, older adults, racial and ethnic minorities, and socioeconomically disadvantaged sort of these subcategories. And that's not Cassie's opinion. That is according to the scientific literature of those who study this information. And we've heard a lot during the pandemic, has consumption increased? And they are finding that, yes, in fact, consumption has increased in specific populations. And it's some of the same here that you see, but also adults with children, which I think is a really interesting one to focus on and perhaps an alarming one to focus on. Moving on to the next trend we're seeing, emergency room visits are increasing. This has a price tag, a significant price tag. And if you can unpack that in your own state, how powerful in terms of making the case for of why alcohol regulation is important. ER visits are increasing across the country by a lot. From 2006 to 2014, they increased 62%. Something is happening here. So we have consumption on the rise, harms on the rise. Are we catching a trend here? Alcohol-related deaths have doubled in the last 10 years. These are significant trends. But the other trend we have is a trend toward deregulating the product, toward loosening controls on the product, when the public health data is telling us a very different story. And sometimes it can be hard when you're working on alcohol to get people's attention when other substances rise to a higher degree of urgency, perhaps. And as a North Carolina epidemiologist told me once, she said, well, with alcohol, the deaths are trickling, slowly, drip, drip, drip. Opioids were hemorrhaging, and that's why it's getting a lot of attention. Fair, absolutely fair. But there is an alcohol story in the opioid crisis. And CDC did a study in 2019 and found that more than half of the 4.2 million people who misused prescription opioids in the U.S. also were binge drinkers. That's an important story to tell. So shifting gears to policies that work and current trends in alcohol, what do we know? What can be done? What are these strategies? Well, the CDC has pulled together an expert panel of public health and prevention experts, and they have a community branch guide, a community guide branch rather, and they take a look at all topic areas. And from 2006 to 2012, they looked at alcohol and how they go about these community the Community Preventive Services Task Force, which is I liken it. It's similar to the U.S. Preventive Service Task Force that you might be more familiar with. That makes recommendations on how frequently we should get colonoscopies or how frequently we should get mammograms. This is about community health, population level health recommendations on specific topic areas. And they took on alcohol from 2006 to 2012. They pulled together expert panels, as I mentioned, of key experts, and they look and do a systematic review of all the science out there about what works and what has sufficient evidence and proven to work, what has insufficient evidence, and what needs more study, or what's been proven not to be effective. And then they come out with recommendations. So let's look at those recommendations. Here you can see these are the strategies they identified that work to prevent excessive alcohol use and related harms. The first is enacting dram shop and liability laws. And the second, and these are not in any particular order, but these were the recommendations: enforcing the underage drinking laws, prohibiting sales to minors, limiting outlet density, and limiting days and hours of sale, increasing alcohol tax, and finally, and I apologize for the slide having some overlap there, but preventing privatization of government control. So if you have the control model, the state is in the business of selling the product, the CDC community guide recommends not privatizing, not relinquishing those government controls. This is the picture. Now, in any one of these, there's a lot to dissect. And how do you get to limiting outlet density? How do you get to limiting sales in days and hours and increasing the tax? There's a lot of different ways to get to these larger goals, but these are larger umbrellas to sort of help guide your work in your prevention strategies. And if you're trying to impact on a population level, these are the strategies that you should be looking to. So this is a body of research I am super excited about, and sorry if I geek out for a moment. But Dr. Tim Namey, he is the principal investigator on this particular study from NIAAA, which is the National Institutes of Alcohol Abuse and Alcoholism. And he has this great research project to look at U.S. alcohol control policies. And they looked at building tools so you can compare the relative efficacy of policies and assess the strengths of states' policy environment. So let's take a look at what they have found. But first, we need to see what they looked at. So they had a Delphi panel of experts pulled together, and they looked at these four kind of buckets of policies: enforcement countermeasures, regulatory oversight, limits on place, products, and price, and promotional restrictions. And there was a lot underneath each one of them. You can read that for yourself. But in short, across these 29 policies, they gave every state a score. They said, okay, what policies does the state have, and what policies are being enforced effectively? And they gave a score. And what they found was that the higher alcohol policy score a state has, the fewer harms the state has. So they looked specifically at binge drinking rates for youth and adults, homicide victimization, and cirrhosis mortality. And I know there are in impaired driving. There's definitely more on their radar to look at those different additional outcomes. But so far, what they have found is that the more alcohol policy scores you have, or the higher the alcohol policy score you have, and I like to frame it as the more safeguards you have in place in your state, the fewer alcohol-related harms. So, how are states doing? They assessed these states over many years, and now they have about almost 20 years of history to look back and say, are states improving or are they getting worse? But before we analyze all the states, what you need to know is that the median score out of 100, the median score that we have in the U.S. for a policy score is 43.5 out of 100. So you can see there's a lot of room for improvement in these scores. 43.5, that's not the best score for sure. And most people think about Utah being a very restrictive environment for alcohol, and they're only at 60. So just over 60. So it's just important to kind of put that in context. So let's see here. The other piece that they learned, let me just say, the deeper the orange color, the higher the score. Okay, so that's important to, in the lower, the more yellow coloring is the lower the alcohol policy score. So on the whole, when they looked at almost 20 years of the scores, they found that most states improved their score. They increased the safeguards they had in place. Most did. But what they found is that when you look at the different policies they were passing and adopting and implementing, they were mostly alcohol-impaired driving countermeasures. They were not about preventing excessive alcohol consumption, which of course is the underlying cause of alcohol-impaired driving. So we've, generally speaking in public health, there's been some really great progress on conveying the importance of alcohol-impaired driving countermeasures, but we have not made that kind of progress on binge drinking and excessive drinking countermeasures. So that's very helpful information to know. And this literature, it's going to continue to evolve. This was just released this year, so this is really exciting to see how you compare to other states, how your state is doing. Again, only a handful of states decreased their alcohol policy score, so on the whole, most states improved. So with that, I am going to open it up for questions because I know I just covered a ton of content and you might be digesting it here, but I would love, and maybe there have been some questions that have populated in the chat as I've been talking. So I'm going to pass it over to Mark to lead us through that. Thanks, Mark.
Hi, I'm unmuted.
I can hear you.
You can hear me? Great. Well, fantastic. Thank you so much, Cassie. That was terrific. So just one way of background, what Dr. Wagner didn't mention is we've been chasing Cassie all over the country for years.
Mark, I feel so badly, but you are cutting in and out, and maybe it will clear up. I don't know, but perhaps if you stop your video, that could help. I don't know. We'll see. Try it one more time. I don't think it's fixed, unfortunately.
Seems to be something with the connection.
Jim, do you want to get better?
Kim, are you going to take over the Q&A if Mark's there? Maybe with his video gone, that might help. Thanks for everyone's patience. I think we've all grown more patient with these types of technologies because it's just our reality of the world we're living in. We have no option.
Kim, are you okay?
Yeah, I'm good.
Good deal.
Excuse me. So, Kristen, do we have any questions that have popped up in the chat?
We do. We had a question, Cassie. It was a statement and then a question. And Lindy brought up the fact that the brain is not fully developed until age 25. So what can we do to bring this fact to the light and try to raise the legal drinking age to 25? She said the fact that not too many people talk about it, but it's really important for preventionists to understand.
Yeah, I mean, the minimum legal drinking age has been one of the single most effective public policies that we've ever enacted in this country. It's estimated to save 1,000 lives every single day, or every year, rather, year over year. So it absolutely is an effective strategy even to raise it to 21 once we did that. And of course, every state has the opportunity to change that on their own. It doesn't have to be from the federal government. In fact, the 21 law isn't. It's still state by state. A state could roll back if they ever wanted to. It's just that the federal government has tied state highway dollars to it, and that incentivizes everyone to go to 21. So I think that's an interesting strategy when you think about policy and trying to move an agenda. If raising the legal drinking age is on your agenda, for example, thinking about mechanisms like we have established with the 21 law as it stands, with the highway dollars tied to it, can be an effective mechanism to move policy. But you have to have political will. And I do think that I know Kim and Kristen and Mark are working on some resources to maybe help all of you work on that aspect, because that's when I like to think about policy from a theoretical framework from Kingdom stream theory. I use that all the time. You have the problem stream, you have the policy stream, then you have the political stream. And often we're not paying attention to that political stream, and we're just thinking about the problem stream, and we got our strategy we know will work, but in reality there's no political will to make it happen. And how do you build that political will? And I would say right now across the country, I would argue we're probably not at a place where we have political will to increase the legal drinking age, regardless of the fact that the data would suggest perhaps it would help save lives and help protect young people. So how do you overcome that hurdle? And in policy work, it's so important to recognize that we can have the best data, but if you don't have the political will to move that agenda, it will never move. So how do you move that agenda with the political will? Kim, I don't know if you want to add to that.
Oh, Kim, you're muted.
Sorry about that. I was just saying, I think you hit the nail on the head with that one. Even though the data might point that way, we have to see where folks are and where they're willing to expend energy, and if you can really get something like that moved through, because working with lots of people on here with coalitions and working with folks in the community, and they have limited time, limited resources, and so we have to make sure that we're putting those efforts into places that we know are gonna be able to move.
Yep, absolutely.
So I have a question, if you can hear me now.
We
yes.
can.
Terrific. Hi. So Cassie, I was just saying, the case for you, so it's great to have you doing it now. My question, two questions. One, what can you do locally?
What can people do locally?
Yeah, much of your focus was on the state, but there's something like the local policy that people can be thinking about.
Yeah, it's a great question. I really appreciate you asking, because a lot of times the coalitions are at the local level and feeling the impact at the local level, and yet the policies are changed at the state level frequently. Not always, but frequently. So, apart from obviously keeping an eye on state legislation, because that's critical, because it comes and trickles down into your local communities, there are a number of strategies that are effective. And alcohol outlet density is one that I think has perhaps one of the most impactful on our local communities. In my Baltimore Good Neighbors Coalition hat work I do frequently, we identify the harms and track and do observational research on licensees. So we have environmental scans that we do to assess price, place, and promotion that is happening inside and outside of alcohol operators within the community, which I know there are countless environmental scan tools out there. So I have no doubt that the PTTC network has a wealth of those to provide for you, which is a real tangible for coalitions to feel engaged in the assessment and monitoring of licenses. So I think environmental scans are really a great tool. But then you can get really great contextual information about what's happening in licensed community, or in your licensees. And when you have that kind of data coupled with violation histories that your regulatory authority would have, and you could certainly request if they don't make it publicly available, you can start telling a picture about what is happening in your community with particular licensees. And so in the case of Baltimore City, we are looking to create an alcohol data dashboard. And who inspired us with that was, and I feel guilty, I keep mentioning it, but it was North Carolina. And the North Carolina Department of Injury Prevention created an alcohol data dashboard, and they have down to the local level data on ER admissions, specific costs, alcohol impaired driving. I mean, you name it, important data variables. You can go to this website on their alcohol data dashboard. And if anybody has the link, I would please put it in the chat, because any state can create this. This isn't unique to North Carolina. Bringing the data into one place, helping it make sense with visual maps using tools like Tableau is such a wealth of great resources and putting, prevention dollars to work in my estimation. And so anyway, you can go to your county, you can print off an 8.5 by 11 sheet and take that to educate your coalition leaders, your policymakers, whomever you wish to educate. It is very powerful. So that is an example of how we were inspired in Baltimore to create a data dashboard. But ours will be a little differently, because it's going to be focused on the local level and licensees in Baltimore City. We're going to be pulling in 911 calls for service. We're going to be pulling in 311 calls for service, violation histories for licensees, planning code violations, health code violations, all into one repository. So there's equity in the neighborhoods in accessing important data to tell the story of the impact of outlet density. Now, remember, when I told you there are these strategies, they're big strategies, limit outlet density. How do you do that? There's so many ways to the end goal there that you do need to have some data to address it. And one way to do that is to create these data dashboards and these concrete examples. And of course, many of you might be interested in social host ordinances, which are a fabulous tool when trying to address social settings in which young people are drinking, and doing those with civil social host ordinances at the local level if you are not preempted, meaning your state doesn't allow you to pass those kind of policies, which is important legal question to answer, because not every state, just because you hear one state did it doesn't mean you have that authority. So you have to dig a little deeper to answer that question. And once you answer that question that you're not preempted, then in fact, social host ordinances at the local level can be a valuable tool. Certainly, we saw significant success in Baltimore County around one college community. In fact, the city councilor said it was the single best policy he has ever passed, because he no longer gets these constant neighborhood complaints every single weekend, because the law enforcement have a tool that works and students get fined heavily. Landlords who rent and have rental permits, they get them pulled, and it works. It just works. But key to that working was that they got law enforcement buy-in early.
Great. Thank you, Cassie. You bring up social host, and of course, we've had an NIAAA study to look at social host around the country, and we'll be presenting some resources on that. But I do want to go back to one more question, and then I'd like to invite my colleague Carlton Hall into the discussion. But my question is something that we talked about a month or two ago, and that you alluded to in your remarks about alcohol outlet density. And that has to do with this topic of alcohol and disparities. And, what are the links with health disparities by race, income, ethnicity, and income, SES? And how should we be thinking about disparities? Is the burden of alcohol-related harms uneven across different populations?
The answer is yes. And you might be a better person to answer this, honestly. I'm not a researcher. I just kind of take the data and try to make sense of it. But to me, this kind of question comes to light when you talk about real communities. And my former community, Baltimore City, had these huge disparities happening in relation to outlets specifically. So we would, you might be a mile and a half away from another neighborhood where, their life expectancy was 83. Their, median income level, household income level was $90,000 annually. They had one outlet per every, 1,000 people. And then you can go over again a mile and a half away to another neighborhood that had, 10 liquor stores per 1,000 people, and median income of $16,000 annual, and life expectancy 63, 20-year gap, a mile and a half away. Huge disparities. And why, when we know certainly that outlet density impacts those disparities and exacerbates it in huge ways, that brings it to light very clearly. And certainly I would welcome anybody else who feels like they have more to share on this particular question, because Mark, it's a really valid one.
Thanks, Cassie. I would just add to that there's this issue that the economists call externalities. Mm-hmm. So I don't have an alcohol outlet in my neighborhood. I go to a different neighborhood to buy alcohol, right? And that's very common. And so thinking about these equity issues, I think, in relation to where alcohol license outlets are, is an important
It is, Mark. And, we've certainly seen that in COVID. I think that's been a big topic of conversation, of the disparities and communities it's been, impacting. But I would also just go back to this data dashboard that the Baltimore Good Neighbors Coalition is gearing up to create. And it's all about equity, because if you have a problem outlet in your neighborhood where shootings are happening and congregating, violence, stabbings, whatever the case might be around this outlet, and if you want to take that case before the liquor board, you have to bring evidence. This is a quasi-judicial hearing. You have got to bring proof. And the way you bring proof is by getting those 911 calls for service and 311 calls for service and their violation history. How do you get that data? It's not very easy typically. And it disenfranchises communities, and some there's not equal access to the data. There's not equal access to the gatekeepers who have the data. So if you bring it all into one place and make it open, to all, you build equity and you reinforce the opportunity for citizens to take that power and that data to make a strong case if they want to the liquor board and have that evidence that they are mandated to have to bring a case forward. And that's one way you can start dealing with outlet density. When you have problem actors, you can at least hold them accountable.
That's great, really helpful. And the dashboard is something we would be able to share with our region. Is that correct?
In July, when it's done.
When it's done, not before it's ready.
That's right.
Well, thank you. Let me invite my colleague Carlton Hall into the conversation.
Thanks, Mark. And just real quickly, first and foremost, Cassie, extraordinary presentation. Thank you so very, very much. It was very rich. I think any one of your slides could have been an in-depth hour-long presentation in and of itself. I got so much from it. So thank you so much for bringing that value. I really defer to my colleagues, Drs. Wagner and Wolfson. This is their wheelhouse. But I listen to things through the lens of a practitioner and for our coalition leaders. And so I kept looking for those tools, and you offered many that I know that our coalitions are utilizing. One of the things that you brought up, which I think really provoked a lot of thought, was this notion of really familiarizing ourselves with the systems in our states and understanding that the aspect of that three-tier kind of system for approaching how we might address or redress policy issues. I was wondering if you might be able to elaborate just a little bit more on how coalition leaders and prevention leaders would and should kind of look at that aspect. You talked about the 4 Ps and what it is that we may utilize and do with respect to understanding how to take advantage of knowing those 4 Ps. And then lastly, you had talked about the Missouri overservice that you thought you might want to, not Missouri, Mississippi overservice. Yeah. So if you wanted to do that. So I just wanted to provide.
Sure. Yeah. No, I'm glad you brought those up. So the 3-tier system is fascinating, and it's being chipped away at in 2 very specific ways. And I do a whole presentation on this if anyone's ever interested. Not that I need more presentations in my life, but if you're interested. But ultimately, it's really interesting because direct shipping of alcohol, going from producer directly to the consumer, which takes the wholesale tier and the retail tier out of the equation. And you miss huge opportunities for control in that. You know, we talked a lot about the wholesale tier, but you miss the opportunity to collect taxes efficiently. You miss the opportunity to ensure you can take tainted products off the market. And so we are exposing ourselves as we allow more direct shipping of products to those potential risks of less tax collection, and states are already feeling that. I will tell you very clearly, there is absolutely tax evasion happening in that sphere, and the fact that tainted products, we don't hear a lot about in this country, but I anticipate if we keep going in this direction, it will not be an uncommon headline that we would see. So that's number one. Direct shipping is breaking down the 3-tier system, and everybody should know about it. And mostly, if you allow direct shipping prior to pandemic, let me just say, if you allow direct shipping, it was all beverage categories, beer, wine, spirit. Fewer states do spirits. But the tainted product becomes extremely critical when you're talking about spirits, because you get one wrong ingredient on spirits and you can go blind and you could die. Beer and wine, not as significant in terms of one molecule being off, but still, I mean, we don't think about alcohol that way, but it is absolutely a true statement. And again, if you heard the headlines from, South America where this was happening prior to the pandemic, I was telling people, if I had friends going there, I said, take your alcohol test strips and test your product because you don't know. And they thought I was nuts. I'm like, I'm not crazy here. It's a legitimate concern. So we are exposing ourselves to those potential risks. Absolutely, in the interest of convenience and e-commerce. And those arguments are winning out in many states at this point. And honestly, prevention isn't at the table having conversations. And you're not going to be asked to the table. You got to claw your way in. So that's the reality. So that's number one. The second, the way the 3-tier is being chipped away at is through e-commerce home delivery. Craft producers. Local craft producers are wanting to be the producer. They're wanting to be the retailer. And when they're small and they're in your local community, it doesn't seem like that's maybe a bad thing. However, it is eroding the three-tier system because they now have ownership in different tier levels, and we've talked about why that could be problematic. The challenge is when these tiny entities get bought up by much larger entities in the country or in the globe, quite frankly. And now they are no longer local entities, but they are massive, massive producers that own them actually. And now we're back to where we were prior to Prohibition with these big producers not living in the communities, not necessarily perhaps having the same interests in the community's health and well-being, and trying to make a profit. That's the risk. I'm not saying that's absolutely happening, but that's the risk. And we got to a really kind of scary place prior to Prohibition, and we had a knee-jerk reaction instituting Prohibition as a result of that. Knee-jerk sounds like it wasn't warranted. There was significant consumption and significant harms happening, so perhaps it was warranted. I'm just saying we are eroding these important systems in our state. That's the reality. We in prevention should absolutely know that information.
Absolutely. Thank you very much.
You asked so many questions, and I took a long time to answer just one of them, but...
Oh, that's great. That was fantastic. Thank you so very, very much.
I'd like to insert another question, if I may, which is the economic interests, especially at the local level. And so, we hear so much about, restaurants and hospitality as an engine for economic development locally. And so it seems like our communities are getting wetter and wetter. We certainly have seen that in North Carolina. And so do you have thoughts about how to push back against the very powerful, local economic development arguments that we often confront in our community work?
Yeah, such a good question, Mark. And I can't even begin to tell you I have the answers because it's a really tough one, especially right now. There is a lot of empathy for retailers right now. And, if your local restaurant's going out of business, that's tough. That's really tough. But at the same time, we are loosening enforcement of different provisions that we're now permitting because of COVID. And I don't want to take all my talking points, but in part two. I don't know if I have an absolute answer for it because it's a tough one to overcome. But I would say where you can quantify outcomes, the harms, when you can put a cost to that can be powerful. When you can have powerful messengers to speak these different angles. So, sorry to use North Carolina as an example, but when they were facing a very heavy privatization debate, one of the spokespeople they had at one of the news conferences to sound the alarm was an emergency room physician talking about the reality of these cases. These are not just, we had a 62% increase from 2006 to 2014 in ER admissions. This was someone telling those stories, powerful testimonial to the realities of these outcomes we see in the data. How do you bring the data to life is critical because the reality is another economic angle is when you have more operators competing for the same patrons, it can often be a race to the bottom. And they're cutting perhaps corners. They're trying to incentivize, ladies' night, other types of kind of incentives to skirt the laws and the rules because they're trying to survive. It's counterintuitive to the economic viability. So when we have a closely regulated landscape of alcohol regulators, you have a much more robust, healthy, fair, and equal and balanced marketplace. So those are just some things that quick come to mind. I hope, Mark, it feels like I answered it, but it's a tough one to overcome for sure.
Well, this can be a continuing dialogue, right? And we can bring our community partners into it as well. So maybe it's something we could spend some time on in part two.
Yeah.
What about home delivery? So you've mentioned, at least in passing, home delivery, and we're hearing a lot about it. How much of a threat do you think it is in terms of public health? Age of sale, how do you do age of sale enforcement with home delivery? And we know it's opening up quite a bit with COVID, as you mentioned.
Mm-hmm. Well, I'm going to say, I'm going to try to be optimistic, Mark, because nobody likes a pessimist. And if in my head, I'm an organizer at heart, and you have to be an optimist. And so I'm encouraged right now that the National Liquor Law Enforcement Association has turned a really close eye to both direct shipping and home delivery and is trying to work with states. Again, I'm sorry, North Carolina again, but the alcohol law enforcement is doing underage compliance checks for home delivery of third-party vendors, and few, to my knowledge, there are not a lot of entities doing that yet. And there aren't a lot of prevention coalitions thinking that way about compliance checks, given these new settings that we're now affording the sale to take place. So the National Liquor Law Enforcement Association is working with ALE in North Carolina to establish a training for how to do those types of compliance checks outside of the brick and mortar. And they're also looking at, they're having conversations with UPS and FedEx that are the primary common carriers that are doing direct shipping to establish what could be best practices for that environment, because the trend at this point is that train is not stopping. So it's happening. And what I would challenge preventionists to do is get on the enforcement piece of it, start tracking it, because what I'm already hearing is that, especially as we've done this with COVID, there's no problem. There's no issue. If we're not enforcing it, how do we know if it's not an issue? And that's the narrative that's going to be told in every legislature come January. So there are opportunities here back to the data collection. I know it's not the end-all be-all, and it is the foot in the door, but you do have to have some evidence to say why the harm is problematic. Now, the other thing I would leave people with is that we don't know if kids are accessing alcohol this way. There is a researcher, again, North Carolina. I do work in other states, I promise you. But in North Carolina, there is a researcher, and one of the only research studies I'm aware of, that has looked at online alcohol vendors and ease of access for young people. And when this researcher went to apply for another grant through NIAAA, they said, well, we'll give you a smaller grant to prove that kids are accessing alcohol that way, or at least answer that question, because we have no evidence that it is happening. So what states can do is add that question to their state surveys so that we can know, are young people, we fear they may, but are they? Are they accessing alcohol through direct shipping and home delivery? We know that there are certainly gaps and that it is absolutely accessible. Mississippi, another example, Mississippi did underage, they did direct shipping. They had direct shipping sent into dry counties. They had wine shipped into a minor's address, and everything went. Major issues. And they ended up taking it to court. Anyway, they won in the end, and now they just afforded direct shipping for wine to retailers that then you physically can go and pick it up at that retail location. So this is a trend we're not stopping, I don't think, anytime soon. So then the question becomes, how do you get the evidence of the fears we have of what the harms could be to substantiate regulations around how, and there are no best practices on it yet because it's just so new.
Yeah. Great. Thank you so much. Well, let's hand it back to Kristen to see if there are other questions from the participants.
We do have one other question someone brought up, and then Cassie, I think we should move in. I think you've got a few slides to sort of entice people for part two. Someone said she'd like to know more about the over-serving and compliance checks, or compliance checks around over-serving.
Yes, that's a great question, and I think these are underutilized tools because they take more time to sit in an establishment and monitor whether over-service takes place. But there's good research being done out of the University of Minnesota with Tracy Toomey and Tobin Nelson, if maybe those names sound familiar, where they're doing more assessments of this. But I'll just talk about the Mississippi case. So the Mississippi ABC is looking to do what's called mystery shoppers for pseudo-intox. And what this is in Mississippi, if you get a sale to an intoxicated violation, you have an automatic revocation of your license. It's a very severe penalty, quite frankly, and they're reluctant politically, you would imagine, enforcement is low on that. And so because of that, they're looking to say, well, let's get an assessment of what is happening. So they're partnering with the Responsible Retailing or the Responsible Retailing Forum that has a program that's it was funded and tested through NIAAA, but they have pulled together, basically they have trained actors who go in and act intoxicated to assess the degree to which licensees are selling to intoxicants. So short of being able to do those more complicated, they're not complicated investigations. They take time and then they take money. And that can be the barrier of not getting them done. So this is an alternative option of having these trained actors to pretend they're intoxicated to assess the degree to which it may be happening. And then you could utilize that data to, in their case, they don't have mandatory responsible beverage service training, and that's something that preventionists are interested in. So they could use that data to help inform that policy discussion in the future if they so chose to. So this is underutilized, but I will say that they place a last drink data collection, trying to get your law enforcement or alcohol regulatory authorities to do place a last drink data collection can help inform where this may be happening, and it can help with then where to target your energy, both from education strategies, but also a dialogue, and then looking beyond that, certainly if there repeats and persists, then certainly violations might be warranted. But that can be, instead of looking at every single potential, it helps you narrow down where to spend resources. And place a last drink data collection is a growing area of evidence that's showing a lot of progress.
Mm-hmm. Great. Thank you for that very thorough response. I think it's important, in crafting legal language to make sure that the penalty structure that you're putting into place is really going to be feasible with the enforcement entity and viable, from the decision maker body.
The theory of deterrence: swift, certain, and severe. It needs to be swift. It needs to happen right away. It should be certain that it absolutely will happen. And severe is the one that's hard to strike the right balance, because if it's too severe, it doesn't get enforced, and if it's too weak, it doesn't change behavior. And how do you strike that perfect balance is the challenge for sure. But swift, certain, and severe, that's the theory of deterrence that we should all be aiming for when we're thinking about these things.
Mm-hmm. Absolutely.
Okay. Carlton, maybe you were going to say something. Yes? No, you're good. Okay. All right. Then I'll go ahead and take on my rest of my slides. Or are you going to guide me through it, Kristen?
I took over the presenter to move some things around.
That's fine. So this is just a prelude to what you might see in part 2, although we had some good discussion here that I anticipate will be woven in. You guys have given me some homework. But go ahead, next slide. So we're going to turn to looking at these policy environments, and so much of this last bit of the conversation and the questions will help guide this next bit of conversation. So next slide. So we have lots of challenges. We talked about many of them. We have increased number of retailers. We have one that's not on here, but we have diminishing resources in enforcing of the licensee community. We have potential risks of tainted and counterfeit products, like we talked about with direct shipping concerns, digital marketing, which we didn't even touch on, but that's a whole nother piece, which I am not an expert on. So I would encourage you, if you're very interested in that, Dr. David Jorgen probably is your best bet. But product innovation with craft producers or Four Loko or powdered alcohol, all of those types of alcohol ice cream, these are product innovations that are changing the landscape and changing what we all have to be aware of. And then, of course, home delivery, like we talked about, both through third-party vendors and also direct shipping. So these are some of the challenges we'll be discussing. So another poll, if you would.
Oh, you know what? I didn't see this poll, so you have to put it in the chat, your response. I'm sorry.
That's okay. It's no big deal. Yes, if you would just put it in the response, the things that I just listed, what gives you the most angst? Increased number of alcohol retail outlets, tainted products entering the market, increased advertising online, home delivery of alcohol. And there are more. I do think the enforcement capacity should be another one I add to this, but A, B, C, or D. And I see people populating those. So I think, Kristen, if you can just capture that so we can talk about that in the next session to make sure we hit on those points. And many of this we've covered, but we'll dive a little bit deeper.
Yeah, it looks like home delivery is winning. We've got a few for B and C, but pretty much we've got one for B, one for C, but everyone is really going for home delivery.
Well, there's such interest on that. We might be able to pull in our partners in North Carolina ALE to talk about what they experience doing their compliance checks and what they're doing and shaping the training around that for other states in the country. If there's interest, that might be a direction we want to complement the presentation on. So we're going to look at three primary factors that are currently driving legislative and regulatory trends. And these are going to be, of course, about COVID. We've touched on a bit, but we're going to spend a little more time there. The public health crisis that has, a bidirectional relationship, interestingly enough, in terms of its impact, and we'll talk more in detail. E-commerce, which, again, we did hit on quite hard, but I have a whole presentation on it. Like I mentioned, it will not be bad to get a refresher and some concrete tangibles, as Carlton is looking for preventionists to really perhaps think about implementing around direct shipping and home delivery. What can you do? And then finally, how the federal courts are shaping changes, and there is a lot of challenge for physical presence of licensees in communities. In Tennessee is a case that I'll talk about specifically that went to the U.S. Supreme Court, and what those state implications are that are not only state but local implications, and what can you do in your role to help in this current moment. So I hope we have given you some prelude to entice you to want to come to this next part 2, because we look forward to that. I look forward to the conversation. So back to you, Kristen.
Okay, so we aren't having any more Q&A. We have done that, but I do want to remind all of you about the evaluation. You can click on the link. I think that would work for you, or you can take a picture of the QR code. I also put the link for the evaluation in the chat. That will get you to your certificate. A reminder about part 2 that will be on Wednesday, November 18th. You can go register on our website, and our website is found below here, pttcnetwork.org/Southeast. You'll be able to find it there, and other webinars that we'll be offering in December. And this is how you can contact us. And Cassie, I would just like to say thank you so much for a really rich presentation today, and I really look forward to part 2, as I'm sure everyone else does.
Well, thank you, Kristen. I appreciate the opportunity. So thanks for all the Q&A, and I'll be back on the 18th.
Great. All right. Well, thank you, everyone.